Hi, for those of you who may not know who I am and what I do professionally, I am an IT project owner. My team and I are building a decentralized application within the global mobile healthcare industry, which means that we have invested more than 30 months or 4,000 hours by now in studying, evaluating, and finding the loopholes in the global healthcare systems as we are working on offering a solution to real-world problem that is affecting millions of people across the globe every single year. As an example, only in the United States, 12 million people get severely affected and may even die every year because the problem we are working on sadly is unaddressed so far. The purpose of today's video is not to promote my project. In fact, ever since the COVID-19 outbreak, I don't even feel like promoting the project anymore, as the human factor kicks in and the sufferings we see around us take over, which really brings you back to the basics where nothing really matters except for being healthy and spending time with your loved ones. The purpose of this video is to show you guys a very, I would say, hidden perspective into the healthcare systems and why I believe these systems are flawed, precisely designed around making profits and putting patients' well-being, unfortunately, far behind. But let me be very, very clear about one thing. I'm not against the doctors or the medical professionals. These guys are working really hard around the clock as we are witnessing during this pandemic. I equally respect and extremely appreciate what these heroes, I would say, are doing. I come from a family of doctors. I personally witness how hard doctors work usually and specifically during these crises. One thing that we may overlook right now is that the doctors have to go through immense mental stress, seeing number of deaths every single day. I'm very sure none of the doctors alive today must have been trained to tackle the situation of seeing people dying and suffering, specifically the elderly. I truly hope not, but if you have elderly in your families affected by COVID-19, your pain is seriously unimaginable. We have been increasingly observing posts on social platforms how people would come up and share the experience of their loved ones, either labeled as COVID-19 patients just because of few unsure symptoms, or patients being left on their own to suffer and die due to lack of resources such as food, beds, medication, doctors, trained technicians, etc. So I am making this video for any one of you who is struggling to find out what to do and how to help their loved ones if, say, NHS or any healthcare system isn't able to cope up with managing the patient's health given the outbreak of COVID-19. Again, I am not a doctor or a medical professional, but you really don't need to study or practice medicine to understand these basics that I am going to share. But yes, whatever I'm going to share with you guys is based on my personal research within the medical healthcare systems across the globe. First thing first, if you are a carer of a patient suspected or believed to be suffering from COVID-19, please understand this. Do not blindly trust the healthcare system. It's called system for a reason, and its primary purpose is to make profits and return those profits to the investors. So like any other system, be it educational or whatnot, the prime purpose of any organized healthcare system is to return the profits to the investors. And yes, if you may not have thought about it, or it may not have ever occurred to you, healthcare systems have investors behind them, period. So do not trust the healthcare system blindly. So should you trust the doctor taking care of your patient? You could, if it feels right to you, but for most of the cases, no, specifically not in this particular situation of pandemic. But why? A, doctors are humans too, and there is always a possibility of human error. Doctors working on the front line are probably not trained for this pandemic, at least not to an extent where they have nerves of steel to take the right decision at the right time. Not to forget, when it comes to saving lives, timing is the crucial element. Number three, doctors, regardless of how advanced healthcare system they're working for, are constrained on the resources. There isn't any unlimited supply of funds magically pouring in from anywhere into these systems. As an example, your patient is in a hospital. The capacity of that hospital is to say manage 500 patients a day. It wouldn't be able to cope up with managing 2,000 patients a day overnight. D, doctors are trained by a system to perform as per the guidelines and the policies and the procedures of that particular system. They cannot, and I repeat, they cannot go beyond the system's policies to save a patient's life because the insurance wouldn't cover them. I really do not want to drag more on this point, but I'm pretty sure you guys must have got what I'm trying to say here. Next, most importantly, there's no vaccination or magical potion that can save the patient. It's about the patient's own resilience. So what should you do? Trust your instincts. If it doesn't feel right, trust yourself, it's not right. As an example, your patient may not have been tested for COVID-19, yet the doctor would tell the patient that they couldn't swab everyone, but it was safe to assume the patient have it. The doctor may also tell the patient that the pain may probably be due to the inflammation from lungs, as an example, and that it's safe to keep self-isolating and taking painkillers. However, self-isolating a patient not tested for COVID-19 will definitely bring many other unseen problems. As an example, fear itself could be the biggest killer than COVID-19 in such a scenario. There are uncounted and unheard stories so far where patients would survive this virus. Explains that the worst part of isolation was the anxiety, stress, and fear. All three killers on their own. Patients in isolation may not be able to sleep. Anxiety may invade with nightmares, and death creeps in. Most of them report that they were afraid of dying without being able to cling on to the hands of their family and friends. I truly hope I could have shown you a perspective of taking decisions in a situation where you feel something isn't right. Your patient would need you to take decisions for them, specifically when they haven't been tested for COVID-19 but put in isolation with already underlying medical condition. Please share this video so that together we may be able to save someone's precious life. Thanks for watching, and I'll see you in my next video.